Welcome to Luca and Miguel. Enjoy the video.
You start with a focused pre-op, confirm medical history, and stop blood thinners as instructed. The clinic measures donor density and maps extraction zones because donor quality dictates graft yield. Once you agree to the plan, they mark the hairline and trim donor hair. This helps visibility and graft handling. Make sure to ask about local anesthesia options and sedation. Discuss expected graft count. You should expect photos for records, consent forms, and clear fasting instructions before the procedure. You will undergo follicular unit extraction using micro-punches. Technicians harvest follicular units one by one, which preserves the donor area and reduces scarring. While extraction runs, other team members dissect and sort grafts under magnification to separate single, double, and triple hair units. This optimizes placement for natural density. Once done, grafts are kept hydrated in chilled solution to prevent ischemic injury. Continuous timing reduces out-of-body time. Make sure to monitor extraction rate versus preservation to protect viability. You finish with precise implantation. The surgeon creates recipient slits that control hair angle, density, and direction because natural appearance depends on those micro decisions. Once slits are ready, assistants place grafts one by one with forceps, keeping handling gentle and timing short to preserve survival. After the session, you get dressing instructions, medications, and a schedule for follow-ups. If crusting, excessive bleeding, or severe pain occurs, contact the clinic immediately. Common fixes.
Thanks for watching and please subscribe. It's the best investment you'll ever make.